Hey, and welcome to Swaay.Health. I am super excited about this particular episode that you're about to watch. It is not very often that we get the chance to interview people from Epic. It is very, very rare that they actually come on camera with media. And so I'm very excited to speak with Sam Seering and Nithin from the Epic Cheers team, which is their CRM product. We're going to be diving into what it is, why it's so valuable, and where they're going with that particular product. I really hope you enjoy this interview. Sam, welcome to the program.
Thanks for having us, Colin.
Thank you. Great to be here.
Now, both of you are coming to us live from your office in Wisconsin, and you're both with that company. I think people have heard of Epic, but I know I was there at the conference in August, enjoyed being on the campus and got to know you. But maybe for the benefit of our audience, if each of you could maybe introduce yourself and just tell us a little bit about your role at Epic, that would be great.
Nithin, do you want to start?
Sure. I'm a software developer here at Epic. I've been at Epic for about 15 years now. Started off more on the billing side of the world, billing and coding and HIM sort of things. Moved over to the registration side of the world for a while, so helping people with intake kind of insurance stuff. Was on our Willow Ambulatory team, which is Epic's product for outpatient pharmacies at hospitals. Then actually got to have the opportunity to go work in Singapore for a couple of years as we were rolling out our software across the country in their public healthcare system. And for the last couple of years, I've been leading up our efforts around Cheers, CRM, and communications.
And my name is Sam Seering. I work on all things Cheers here at Epic, which includes all the topics that we're going to be talking about today: marketing automation, contact center operations, patient experience. But then as part of that work, I also have the opportunity to work across the company on all things related to improving the patient and consumer healthcare experience.
Excellent. It's great to have you both on the program. I've definitely been hearing a lot more about Cheers and which is the CRM solution from Epic. But can you both give me a kind of an overview of what it is and the challenges that Cheers is really designed to address for healthcare providers?
Yeah, absolutely. I can take a stab at starting us off, and Sam, feel free to jump in. Cheers actually, Colin, today is two separate products under the hood. First is what we call our contact management product, and that's a set of tools to help our customers run different types of contact centers. So whether it's a patient access contact center, a patient relations contact center, health plan contact center, so helping their patients' members get the help they need, and kind of having an integrated CRM system that weaves in and out of our workflows, handle things like task management and things like that. The other half of Cheers is Campaigns, which is our product for automated face-based outreach for both population health care gap closures, as well as for marketing reasons for patient acquisition and new service lines and things like that. So, and the goal of kind of both those two products, I'd say, is to have a consolidated way of tracking communication, both on the incoming and outgoing side, with the goal of kind of facilitating whatever that end goal for the consumer, the patient on the call is, whatever the help they need, either in a reactive way or proactive way, kind of helping nudge that goal.
And really, what we saw our community members telling us is that they wanted to create more personalized and meaningful experiences, both with their existing patients and with the patients that they were trying to attract into the organization. And so that's where Cheers comes into play, both for that automated outreach through campaigns or the reactive side of the contact management solution of bringing to bear the rich amount of information that already existed within the Epic system in order to create those personalized and meaningful experiences.
It sounds like to me that Cheers is really the approach that that users of Epic can take to really bring their patients closer to the information that's inside Epic in news in different ways. This is sort of beyond the portal, right? You're talking about personalized messages and the personalization there, which is really cool and unique. And hey, anything we can do to bring people closer to their data is a good thing, right?
Exactly. And I think one of the things that is a differentiator is the breadth and depth of that data, right? I think oftentimes people might think and say, oh, Epic, it's kind of EMR data. I think that is one facet of it. Obviously, we have deep, rich clinical information that is longitudinal and follows the patient. But I think what most Epic customers know is it's not just that, right? You have kind of a fuller profile of your patients. It's your demographics, your next of kin, what insurances you have, a financial profile understanding, are you having difficulty paying? Things like social determinants of health and communication preferences as well. So what we've seen over the last couple of years is really our community kind of take advantage of the breadth and depth of that integrated data to facilitate better communications.
Yeah, I'm really glad you said that, because you're so right. Health is about more than just the clinical data. All the stuff you just mentioned, social determinants, financial profile, geography, those all factor into how we would love to be communicated with as individuals. And it's great to see that the Cheers product is kind of designing itself around fulfilling that need for your customers. So let me ask this question of both of you. Can you share some specific examples of a customer and how they're using Cheers to engage or maybe increase the inflow with patients?
Yeah, absolutely. We've seen a lot of excellent examples across the Epic community, and we pretty much hear a new use case almost every single week. So a pretty clear example of this, and where we really started from an outreach perspective, is in that population health bucket. So how can we use the information that we know about existing individuals to then reactivate them into the care that they need? So a very clear example of this is Stanford Healthcare out in the Bay Area. They wanted to make sure that their Medicare Advantage patients, those individuals that were attributed to the care of the organization, actually were coming in for their annual wellness visits. So they established a stakeholder group across their marketing department, their population health team, their clinical operations, and IT to build out this annual wellness visit campaign. And because of that, they were able to see an astronomical 30% conversion rate for that campaign that they were actually running. So making sure that those folks were coming in and getting that care. A lot of the times, though, it's also not just about driving appointment volumes. It's also about how can we learn more about you as an individual so that we could better serve you in the future. So we've had numerous organizations that have run what we call data collection campaigns, where it's about asking them and asking patients, what do you want us to know about you? And this is spanning different areas, whether it's social determinants of health information, whether it's race, ethnicity, and language information to know what language do you prefer to be communicated in, or something like sex, gender, and name information, so that we're respecting your preferences as a patient. And the benefit of running that sort of engagement through an integrated platform like Cheers is that it's not just now available to us within our marketing stack, it's fully integrated into their entire healthcare experience. If you were to attempt to run a similar type of campaign in another CRM system, the clinician that sees that patient 6 months later, or the billing staff member that's having the conversation about establishing a payment plan, won't have access to that information, and we're no longer fulfilling that enterprise promise of that personalization for that individual.
Yeah, I'm going to put it in my terms here, and I apologize for doing this, but Sam, it almost sounds like what you're saying is you're taking what traditionally has been marketing data and now making a longitudinal record that someone can see across the entire organization, right? Like all those language preferences, the communication preferences, that's now available, as you just said, throughout the clinical journey as well as the marketing journey, where traditionally in a traditional CRM, that's where it would live, right?
Exactly. And that's because at Epic, we have one unified code base for all of our applications. So when we learn the preferred language of a patient, it isn't just for the original use case. So this also flows the other direction as well. if somebody says, I prefer to be communicated in Spanish as part of a front desk registration or maybe an e-check-in workflow, that's now automatically available to the marketing and population health team to use as part of that automated outreach. It's actually funny. I was just talking with an organization last week where they're using today a third-party tool, migrating to our capabilities, and they said they have multiple instances of a third-party CRM software that even those softwares don't even talk to each other. So they're using these capabilities, but then it's still siloed across the organization. Whereas we take a very enterprise and integrated approach with the types of outreaches and engagements that we drive through Cheers.
Well, and the proof was in that example you gave where, you had such an increase, right? 30%, increase. I mean, that's incredible numbers. And I would have to think that the personalization, the use of all that information is what's helping to drive those incredible numbers.
Yeah, absolutely. I think it is a combination of the personalization. I think understanding what engagement channels work best for a person. So we've seen that a lot of folks, the more likely you are to give them access to MyChart, the ability to schedule their own appointments. You send them that nudge with a link to say, hey, go ahead and schedule this appointment. They're much more likely to do that, much more likely to do that compared to sending them an answering machine or a call back to the contact center.
And I know, Colin, you've been discussing a lot lately with guests on the show, as well as some of your personal content around that self-scheduling element, meeting that promise of that great first experience with the organization. And that's one of the unique value propositions that we bring in this space, is that we have the ability to provide what are called scheduling tickets to patients. And so these scheduling tickets, you can think of as almost like Willy Wonka golden tickets to the chocolate factory, where if I have that golden ticket in hand, I'm allowed in to have the tour of the chocolate factory. The exact same case here is that if I have a scheduling ticket, whether it's for my annual wellness visit, whether it's for a colonoscopy, whether it's for a diabetic retinopathy, when I have that ticket in my hand, I'm allowed through the gates and I can now self-schedule that regardless of if I have a MyChart account or not. And so this can be very beneficial for organizations that might have some provider trepidation of turning on online scheduling for the general public. But now, using the Cheers capabilities, we have the ability to say only the folks who are qualified for these types of appointments are going to be allowed in the door. But for those folks, they are going to have that wonderful frictionless experience of booking that appointment.
Thank you, Sam, for explaining what a scheduling ticket is. I just said the word and I'm like, everyone knows.
Yes.
But, now I think what Epic has to do now is partner with a chocolatier, right? So now you actually the chocolate when you
we should do something with Timothée Chalamet with the new movie coming out.
There you go. So let me ask this question. I mean, you guys, Sam, you were on our mutual friend with our mutual friend Jared Johnson on his Healthcare Rap podcast, and on there you spoke about something that I found really interesting about how Epic is in a unique position to be able to bring together many of the different actors and players around that affect patient experience together. So I'm talking about providers and payers and everyone like that. Can you maybe dive into that more for us here? What did you mean by that statement, and how can Epic bring all these people together?
Absolutely. So this has really been a journey that Epic has been on for the last probably 5 years, is building out what we call the health. So historically, our traditional customer base has been hospitals, health systems, providers, and they really make up that core of that health grid. But of course, as you know, it's not just health systems that are involved in providing care and achieving great health outcomes. It's payers, it's laboratories, it's retail organizations. And so that's where over the past few years, we've been building out these nodes across the health grid. So a couple of key examples of organizations or types of organizations on the health grid and how that relates then to the type of outreach that you'd be driving through Cheers, there's really kind of three main examples. The first of all are the retail health organization. So your entrants to the market, such as CVS Minute Clinics and Walmart, they're part of that health grid as well. And a pretty easy example of this is a lot of individuals get their flu shots or other vaccinations at these retail organizations. It's great then to have data automatically flow from those retail organizations over Care Everywhere, which is our interoperability network, to hospitals and health systems to know this is an individual that I don't need to engage because I already have their vaccination record from one of those retail health organizations. The second bucket is our specialty diagnostic laboratories. So these are folks who predominantly are working on more advanced testing, such as genetic testing for individuals. Now, what we've done is enhance the data exchange, where historically the provider, when they got one of these tests completed by one of these external labs, they just got a PDF printout of the results and then had to try to explain it to their patient. Because we've built this network effect, we can now bring discrete genetic variant information and associate it with the patient record. So an example of how this could be used from a personalization and outreach and marketing perspective is that if an individual has a test, say completed by Myriad Genetics, to identify potential BRCA1 and BRCA2 genes at elevated risk of breast cancer, we can include that as a data element for personalization. So that when I'm running my mammography campaign, I may change my messaging if that individual that I'm engaging has one of those genetic variants versus not having one of those genetic variants. And then the last place that we really see as expanding this health grid to impact the type of outreach and personalization is integration with payers. So we have on the network, we have the 7 largest payers in the United States, as well as a number of regional blues and payvider organizations. And one of the pieces that's exchanged over the network is care gap closures, which is a pretty seemingly easy concept, but was complicated because the health system would say, here are the list of care gaps that I need to close for these patients. And then the health plan would have other data, say the claims information coming from other organizations saying, no, this is the list of care gaps that you need to close. And so through our integration over the payer platform, the payer can say, no, here are the care gaps that we've already actually closed. And we've seen organizations close tens of thousands of care gaps just by going live on that capability, which allows you to focus truly as a marketer or as a population health leader just on the individuals that still need that gap actually closed as a patient.
And the impact on the patient is that I'm not being inundated with messages for things that I've already done. And therefore, I'm more likely to listen to whatever message is coming to me because I feel that the health system, whoever I'm dealing with that has Epic, knows me. Like it knew I went to Walmart to get the flu shot, so it's not bugging me for that. And so when they do send me a message around, hey, I need this other thing, you're more apt to listen, right? Because you have this sense that they're actually really truly looking out for you as the individual, as opposed to the overlapping with other organizations and not realizing what you've already done.
Absolutely. I think having all of these connections helps give us that complete picture. But in addition to that, I think there's the communication aspect of it, which you touched on, that yes, we will be able to send way more meaningful communication to patients. But with these connections as well, kind of our overarching goal has been reducing friction in care from the perspective of the patient, right? You're dealing with the health system, but my dad had cancer for the last couple of years, and I've been on probably like 500 phone calls with his doctor's office, his insurance companies, kind of trying to bridge all of that gap. And I think with the set of tools we're building, with the connections we have, I think we have an incredible opportunity to try to kind of reduce some of these friction or eliminate it completely.
Sam, I got to ask this. What's next for Epic Cheers? What can customers expect over the next 12 months?
There is a lot, so I had to kind of pick and choose probably what I wanted to talk about. So there's a few things that I'm especially excited about. One of the things we recently released for what we call existing patient campaigns is what we're referring to as kind of more automatically surfacing of a downstream outcomes. So think of it as out of the box, not just knowing who you engaged, did they actually engage with the content I sent out? Did they convert? And what was the downstream result of that conversion? So for a mammogram campaign, not just knowing who completed their mammograms, but being able to surface up how many early cases of breast cancer were actually diagnosed and kind of bring that up as an out-of-the-box dashboard. Our sense is this will save people a lot of time in terms of kind of manual digging in that they end up doing to surface this up. And what we're looking forward to doing next year is surfacing that up as part of patient acquisition campaigns. So for new business that you bring in, being able to tie it directly to your hospital billing, professional billing revenue data, and trying to surface up how much revenue did you generate as a result of running this campaign, and longer term, even being able to tie that to the lifetime value of an acquisition. So I think that is one area around prospecting and analytics that I'm pretty excited about. The second is kind of baking capacity into our outreach and campaigns. So slight deviation, slight tangent for a story. I did get a message last March from my health system asking me to come in for a allergy consult because allergy season is coming up. This was the first time I ended up actually having a mild allergy. But when I tried to schedule it, the earliest available appointment was in December. I would have much rather they not send me that message. So being able to break in more smarts around where do I have capacity? Where do I have more demand for services? And being able to guide marketers into kind of identifying specific opportunities for campaigns, but within a campaign itself, being smart enough to titrate outreach and not send messaging to patients if we know that capacity is limited. And finally, I'd say on the contact center side of the house, it is kind of making, how do we prioritize more convenience, more options for your patients and consumers? So adding new channels of engagement. So coming up early next year or we just released it actually. So it is available now for some of our early adopters is a live chat product. So being able to engage people who land on your website, being able to connect them to a contact center agent, being able to guide them through bot workflows through any self-service needs as needed, and then expanding that chat capability to within MyChart, being able to escalate to a contact center agent from a SMS conversation. So those sorts of features across engagement channels to be able to guide patients to the help they need on the contact center side is a big area of focus.
And are there any specific technologies that you're considering? Like, obviously the buzzword AI. I heard the word chatbot in there and connection, but are there any technologies that you're thinking about incorporating into the Cheers portfolio?
Yeah, I mean, AI is a big one. It's not limited to Cheers, and Sam will probably touch on this a lot more, but across Epic, we are working pretty closely with Microsoft and OpenAI to kind of have that layer of validation to make sure that we're removing hallucinations and things like that. And there's a few different use cases across the company that we're leveraging AI and LLMs for. Specifically on the chatbot side of the house, where we're starting off with is specifically for more intent detection and entity extraction. So from a blob of free text, being able to recognize what the intent is and being able to parse out certain pieces so that we can guide that person further down that path. We are being a little wary around kind of having an LLM automatically spit out content without having it go through a review layer first. So anything that is generated text, at least right now, is not kind of LLM generated. But as we get more conversational, I fully expect that over time across channels, we will enable more and more conversational based approaches as we work with Microsoft, OpenAI, and kind of build up the capabilities of the chatbot layer.
And to add on to that, as a concrete example, I talked earlier about those scheduling tickets to enable that self-scheduling capability. What we're working in concert with our Cadence team, our scheduling application here at Epic, is coming out early next year, is conversational bot-based scheduling entirely through text messaging workflows. So that today, when you get that scheduling ticket, either through email, text message, push notification, you click a link and you go into essentially a web portal or a microsite experience to do that booking. What's going to be coming now through the use of this generative AI capability is simply being able to have a conversation entirely through text message so that we can say, hey, Colin, it's time to book your annual physical. Do you want to book it? You can just type back, yes, I would like that. Do you have any times available on Tuesdays? And then the system will automatically find what are the available slots on Tuesdays for the type of appointment that we're wanting you to book. And then you can say, yep, that appointment 3 weeks in the future works great. And then you conveniently get your e-check-in message directly after confirming that appointment. So that's kind of a concrete example of how that generative AI capability is going to be applied. The other place that we're just starting some work on that I'm really excited about is we're starting work on a marketing co-pilot, where as you are building out your campaigns, being able to do things like identify, we're wanting to engage individuals as part of their cervical cancer screening, but we want to change the messaging based on different attributes about the individual. Can you recommend some different messaging that we should consider for targeting different populations, whether it's based on age or race or ethnicity, and have that populate into the system and then automatically build out the outreach campaign in the system based on the conversation with that marketing co-pilot?
Thank you for that. I mean, it's great. I mean, I'm looking forward to the day when, and I have to borrow this term from someone I heard it from. The future of UI is no UI, right? Like it's all about, as you just said, Sam, interacting with these smarter systems, whether that's through text or voice, and not actually having to, as you said now, like shell out to an actual application somewhere or on a website somewhere to actually physically do something. It is just through whatever interface I initiated the conversation. So I'm definitely excited and looking forward to that. I'm sure your customers are excited for that too.
Customers are excited. Honestly, we as developers are super excited working on this stuff as well. Like Sam mentioned, the marketing co-pilot right now is very much in kind of a prototyping testing stage, but we are seeing some very great results initially as well. So it is very exciting.
If I can ask both of you this question, what would you say to all the Epic customers who are listening and watching this? What would you tell them to say, hey, you should really give a real serious look at Epic Cheers for their system?
Yeah, I'd say a couple of things. One, take a look at what existing customers have done, what outcomes they've achieved with the software today. I think we've got Sam talked about a couple of them, but there's many more available on the Epic user web for folks to be able to peruse to just see what customers have done over the last couple of years with both recent functionality we released and with the product as a whole. The second thing is this is an area where over the last year or two, we've done a lot and we continue to build a lot. So what I'd encourage customers to also be aware of is kind of the roadmap where we're headed, because there is a lot coming over the next year or two as well. So I think having the complete picture of what we're trying to build and what we expect the end goal to be is something I'd want every customer to know.
The other piece that I would simply add on to it is make sure that as an organization, you know what you already own. There are lots of capabilities, not even just within Cheers, but across all of Epic, that marketers or other leaders who are driving patient acquisition and patient engagement can take advantage of across the entire Epic system. So make sure that you're aware of simply the capabilities that you already have in your system and not needing to go out and buy a bolt-on application, spend 9 months doing an integration project, and then maybe starting to get some value from that.
That is a great point, Sam. I can't tell you, Colin, I've lost track of the number of times I go on site. It's part of demo and the marketing team kind of looks at what we have and they're like, oh, I had no idea Epic could do any of this. So there is still a lot of, especially for marketing folks who've kind of been away from the traditional IP structure, there is still a lot of kind of just knowledge sharing to be done.
It definitely sounds like what you guys are saying is, the time to value when adopting Epic Cheers is much quicker because everything is already pre-integrated and works well with the rest of Epic. Versus maybe another system where you have to go through that extra exercise and maybe some deeper integration.
Yeah, absolutely. It's no longer about the technology as the rate limiting factor for starting to get value. It really is about, and this is the great piece about working with our customers, is that it's working to align the marketing goals with the broader strategic initiatives of the organization, and then deploying that through a completely integrated platform.
Sam, Nithin, you guys have both shared so much great information today about Cheers. Where can people go to find out more information if they want to do more exploration on their own?
Yeah, so Nithin and I are always willing to have conversations. So we both are active on LinkedIn, so feel free to reach out to us there. Also, reach out to us at cheers@epic.com. Super easy to remember. Nithin and I monitor that every single day. And then lastly is that if you're an existing Epic organization, we have a website called roadmap.epic.com where you can see not only for Cheers, but across all of the different areas of Epic, what's available today, what's under development, and what's coming in the future so that you can really start to align those with the strategic priorities of your organization.
Well, gentlemen, appreciate everything you shared with us today. I really appreciate you hopping on our program. I know you don't do a lot of stuff with the press, so definitely appreciate it. And good luck with everything you're doing.
Awesome. Thanks so
Thank
much,
you so
Colin.
much. Have a good rest of your day.
Yeah, I want to thank Sam and Nithin for coming on camera with me. It is very rare that Epic comes on camera with media, so I am very appreciative of them being willing to come on the program. I also really enjoyed their conversation and their sharing with us around the time to value. I really thought that that really hit home as to why the Epic Cheer system is getting a lot of traction is because the integration is already there with Epic. And you heard how the information that's traditionally held in a CRM can then be flowed back through to the clinical side there and thereby improving the experience and the engagement across the entire system. And hey, if you enjoyed this interview as much as I did, please like and subscribe. Also, head on over to Swaay.Health, Swaay with 2 A's, .health. That's where you'll find more great content like this. I'm Colin Hung. Thanks for being here, and I'll catch you on the next video.